The recent outbreak of coronavirus has spread further worldwide. In the week from March 2nd to March 8th, more than 10,000 of new cases were diagnosed out of China. However, different countries have different attitudes on whether people need to wear masks. Why do people wear masks in the combat to coronavirus? The spread of coronavirus is mainly through respiratory droplet and contact transmission. The virus enters the body through the eyes, mouth, and nose, hiding in the lungs, deeply infecting the lung, and harms humans' health. The incubation period of coronavirus is as long as 14 days. And in the incubation period, one can also infect the surrounding people. That is to say, the infected person has no symptoms in the early stage. And he does not even know that he has been infected. So he is likely to pass by like everyone else and spread the virus all the way. During the spread of the virus is not transmitted alone, but often through the air during breathing, chatting, coughing, and sneezing, especially the large particles of droplets when coughing and sneezing. A sneeze contains various pathogens. In addition to sneezing, there is a high risk of infection when standing by the patient. Some studies have placed influenza patients in indoor environments and detect the virus in the surrounding air. It was found relatively safe to stand at a distance of about 1 meter. This is also a recommended safety distance for people who do not wear masks. What does this mean? Imagine you are in a crowded supermarket, subway, train, or going to the hospital. Can you always keep 1 meter away from others? Then, is it useful to put on a mask? An Australian study investigated the use of masks and respiratory illnesses in 143 households during the flu season. After using masks, the infection rate decreases by about 60% to 80%. In addition to the family contact, students in dormitories are also studied. The researchers selected more than 1,000 college students and run controlled experiments on masks and hand washing. The infection rate was reduced by 48% to 70% compared with the control group. These numbers tell us that it is important to wear a mask in the season of epidemic disease, compared to exposing your mouth and nose without any cover. Look at these 2 cases released on February 5th and February 6th. One person went to the market, stayed close to an infected person at the same stall, and later tested positive. Another person went to the pharmacy, stayed close to an infected person at the counter, and later tested positive. In both cases, the contact lasted for less than 1 minute. The common point is none of these people wore a mask. Wearing a mask is one of the effective ways to prevent virus infection. It prevents viruses from entering our bodies. Even if an individual is unfortunately infected, it prevents further spreading of the virus to others. In addition, we need to avoid direct contact between people as much as possible. Wash your hands after touching any foreign objects. And try to avoid rubbing your eyes, touching the nose, mouth, and wounds. Wearing a mask does not mean getting sick. It's just about protecting yourself and others. Viruses are ruthless. People are not. At this very moment, let us work together to win the war against the virus.